rectus femoris, iliacus, iliopsoas. All right, got that? Now we're going to come in here and we're going to test the sartorius right here. Okay. So we're going to, what does the sartorius do? It flexes and brings the leg in. So we're going to do the opposite of that. Hold, hold. I have to teach this to you, but I can't remember the last time I even saw somebody with a sartorius that was weak. Okay. Look at where the foot is right here. All right. Here. Okay. And here we got the continuation. We actually, this is part of the vastus intermedius. All right, vastus medialis, vastus lateralis. The lateralis is looking at me. The medialis is looking at me. Okay, so let's do that again. Y'all didn't get it the first time. All right, so doing our exam. Now here what we're doing is, of course, we're assuming that since this is a lower extremity, you know, everybody's coming in for low back pain or lower problems. This is what we're working on this weekend. All right. Somebody comes in with a hip pain, you got to do this. Okay. Problems with the foot is going to cause hip problems. So don't sit here and just look at the hip and go everything's, you know, hunky dory with the hip or whatever. Or we're just looking at the hip and treating those muscles there. All right. So number 1, rectus femoris. Number 2, iliacus. Number 3, psoas, 30 for 30. All right. Then we come right here, sartorius. We're going to pull up like this. All right, relax. His foot's already in this position. Now look at this. Let's drop that a second. Now look at where we are. So we're to right here. For the confusion, thanks for the clarification. If you don't understand what I'm asking or saying, just get with Carl. All right.
Can you name the muscle as you go through them?
Yep, that's what we're going to do this time. All right. So just relax for just a second. So look at how we did this. We figured out a way to go in here and go, okay, how do we set the foot up that's in an economical way, a fast way to just knock out this femoral nerve. Nice. And then we're going to come down here. What's the fastest way to knock out this superficial or superior gluteal nerve? Then what are we going to do? We got to test this one laying on their stomach. So we're going to test that one in a minute. Okay. And then we haven't got down to the foot yet. But these are the muscles that we tested so far. Okay. And we just do it in a systematic order. And so we come in here, and here we go. We're going to go through the whole thing this time.
So actually, if you reverse that end thing, put the TF down first, then the other one, then the one down there.
Be in the order that
It'd be that order. Okay. Yeah. I'll have to do that next time. Okay. So here we go. So I'm going to name the muscles, and so here we go. All right. So rectus femoris, and look at where my hand. Look at this arm is here, and see how you got to be perpendicular. You got to be at a 90-degree angle right there. Okay. So hold rectus femoris, iliacus, psoas, sartorius. Bring this leg up, all the way out. Hold vastus medialis, vastus intermedius, vastus lateralis. The foot's already turned in right there. Okay, drop your leg down. All right. The foot's already turned in. So now all we have to do is take this foot and push it down here. Hold. Okay, tensor fascia lata. Toes up straight up at the ceiling. Hold. That's the gluteus minimus, gluteus medius. Hold. And we just take the patient's foot and move them right there. Come over here and I'm going to pull this muscle out here and hold it. Hold. All right, now what I need you to do is take your whole body and put it over there and hold. I mean, I don't know how long that took. I explained it to you. It probably didn't take 20 seconds. Right? Group of muscles that work together. All right? So here, just relax. And the reality of it is, it doesn't matter which order you do it in, because you got to take the foot up and in and pull it down and out. Okay? The foot's got to go up and out, and you're going to push it down and in. Okay? All right, and then it down and out. All right, relax for me. Okay, bring it here. Just relax because I'm going to push it up like that. Hold your toe down here. Okay, so it's up and in, up and out, down and in, or down and out. Sorry, down and in. And to test it, you just got to push it in the opposite direction. So here we go, up and in. All right, tibialis anterior. All right, here, good. And then here, hold, good, down and out, Peronius. So he got it down and out, so I gotta push it up and in. Everybody with that? I gotta push it up and in, okay? All right, relax. And down and in, I gotta push it up and out. And you gotta be at that 90 degrees, that's the key thing. Look at where his foot is and look at where you're pushing, okay? 4 movements in the foot. Up and in, up and out. Down and in, down and out. And you push in opposite directions. All right, so up and in. Let me do it on myself. You're good, but I'm gonna point. All right, up and in. So that's tibialis anterior. Okay, and then up and out is your extensor, extensor hallucis longus, and extensor hallucis longus, and extensor digitorum longus.
Okay.
All right, down and out, Peronius longus, Peronius brevis, and then down and in is posterior tibialis. All right, so we got 12 muscles we got to test in the leg, 4 groups of muscles in the foot. All right, so I need a person. Down, push.
Rectus femoris.
Heel down. Deep breath in for me. Push. Good. All right. So that's the superior end of it, and then we come in here on the belly, and it's going to look just like what we did with the infrapatella. I'm going to come in here, deep breath in for me, breathe out, and drop your heel down for me. Drop it down.
Oh, okay.
Deep breath in for me, breathe out. Heel down. Down. And just a couple places in here. Okay, so here, right under the ASIS, and we're going to go right down this muscle. Next, we're going to come in here, and we've got to get the iliacus. Now, the iliacus, what we're going to do is it's going to start in this position. The reason that's important is because the iliacus and iliopsoas, the starting position is the same. Okay, is where the foot ends up is different. Okay, so deep breath in for me. This is iliacus. You're going to turn your foot out. Drop your foot, heel down. All right, deep breath in for me. Breathe out, turn your ankle out. Drop it down. Heel on the table. Turn out.
You still just below the ASIS there, Andy?
Medial to the ASIS. Okay. All right. So here, femoris, come in. I mean, this is when I'm doing it. It's like this right here. See that? How my thumb is bent. Right there. Okay. And then when we do the psoas, I come in here with my fingers, just like that. Okay, so it'll be, again, the iliacus and the iliopsoas, they're like brothers and sisters, if you will, or 2 brothers. I mean, they work together. They're just in different areas. That is in the ilium and the psoas. Psoas starts at T12, 1, 2, 3, 4, 5, and then it comes together with the iliacus. Okay, so you see how it comes together right here? All right, so we're going to start out in the same position right here. All right, so I'm on my landmark. I'm in the right position. Deep breath in for me, breathe out. Turn your ankle out and heel down. Keep your leg bent. Okay. Turn out. All right, now on the psoas, we're going to drop the leg below the table. All right. Now look at this just a second. So this is iliacus, and all I'm going to do is I'm going to take my fingers and I'm going to turn it in just like that, and I'm going to go straight to the belly button. Okay, because look at this right here. Here's the iliacus. So rectus femoris. All right, deep breath in for me, breathe out, heel down. Heel hits the table. Heel's got to hit the table. Go. Lights right here. Let it go. Deep breath in for me, breathe out, heel down. This table's a little bit too high for me. So you realize some of y'all that's a little bit shorter, it's going to be challenging a little bit. All right. So the 2 moves for the iliacus and iliopsoas. Foot's going to come in. Get your landmark. All right. Deep breath in for me. Breathe out. Heel down. And almost all the time, every time, the iliopsoas is going to be weak, and we just turn right in here and straighten your leg out, drop it below the table. Now this is one of the things that you're going to end up doing. You're going to end up assisting the patient right there. You're not going to resist them. Okay, all right, pull down. He's got to pull that leg down. Turn out. Try to let your arms do as much of the work as you can and not bend over a whole lot. okay? So that's the rectus femoris, iliacus, rectus femoris, iliacus, and psoas. Now, circulation, the foot's gonna be turned out, and he's going to pull me toward him, okay?
I'm pulling my heel.
Yep. Just like that. All right, now, what I'm gonna do is I'm gonna capture his ankle here. That's gonna be my traction, my resistance. And I'm gonna come in here with this hand, and I'm gonna go right there, and this is how I support it. Okay? All right? Good? All right. So let's do that again. So the vastus medialis, the foot's got to be turned out, and he's going to pull me up toward him. So again, you make him work. You don't have to work here. All he's got to do is pull you up. So here's our contact. Here's our support. Deep breath in for me. Breathe out and pull up. Pull me up. Good. Deep breath in. Breathe out. Pull up. And remember, the muscle's right here. Now, what I'm going to do is I'm going to skip one thing and just, since we're right here, I'm going to show you how to do the obturator muscles as well, the adductors. All right, it's just like the vastus medialis, but we got to do a frog leg. I mean, when he does this, we got to get pulled all the way up here. And I'm telling you, when this is weak, it hurts like a freaking mother when you have to work on this. All right. So there's the vastus medialis. We're going to come right here. Deep breath in for me. Breathe out. Keep your toe out and pull me up. Just like that. Deep breath in for me. Breathe out. Deep breath in and breathe out. Okay. So that goes right in that with the obturator muscle group. Okay. So vastus medialis here. Deep breath in. Pull up. Good. Now the obturator, he's going to breathe out, pull up. He's going to pull me all the way. I'm in here. We're going to capture the foot. All right. Here's my contact hand. All right. Deep breath in for me, breathe out. Pull me toward you. Pull me toward you. And there we are. Okay. What the muscle does, it's here. Okay. And what we want to do here is we're going to take I tell the patient, let's go ankle to ankle. So when we do this, we want to do this. Okay, or heel to heel, I'm sorry. I don't know why I said ankle to ankle. Heel to heel, like that. We're here, we want to do this movement, all right? So there's a couple ways you can do it. If you're laying on your side, if they're laying on their back, that's going to be the instruction. When they're lay on your side right here. I'm sorry, this side up. What you can do is the foot's like this, okay, and then he's going to drop it down like that, okay. I don't typically do it on the side. It's almost always right here when I do this. So it's just this simple. Here is we're gonna lead here, turn your heel in. So I'm gonna start right here. This is really what I'm resisting with right here. This hand here is doing mainly the PDM, but I can get an SPDM here, and this hurts sometimes with this fasciitis. So we're gonna start up here. Deep breath in for me. Breathe out. Foot down. Turn heel to heel. Good. Heel to heel. And heel to heel. There we are. All right. Now, you stay right where you are. Now, I do this with my hands. Now, with this part here on the glute medius and minimus, I'm going to use the vibrocursor for that. All right. Or you can use the arthrostem, but the way we have it set up now is you can actually get those heads and it'll go right around this area. You put the correct heads on there and you can make it C. You just put it right here, okay? And we're gonna take a deep breath in for me, and you're gonna drop your knee straight down to this other knee. Okay. Knee to knee. Deep breath in and go. Now this is not a correct PDM because again, what I do is I use the vibrocursor or arthrostem, whichever one you want. But all right, deep breath in, knee down.
Where's your line of drive, Andy?
I guess
Line of drive with
straight down.
No, with the PDM, like which way are you pushing?
The PDM, because the muscle fibers are going from the ilium down here, so you want to go in like that.
Okay, so it's just straight medial, or
So if you got the vibrocursor and it's like this, you need to move it in that direction.
Okay.
You need to move it like that. Okay. All right. Now,
Andy, with the vibrocursor, what head do you use?
It's the multi. All right, so rectus femoris, deep breath in, before we breathe out, bring it down, and just let your body do all the work here.
Rectus femoris.
Just keep your knee bent. And then take your heel down like that for me. Deep breath in for me, breathe out, heel down. Heel down. And heel down for me. And then got the iliacus. Deep breath in for me, turn your ankle out, heel down. Ankle out, heel down. Ankle out, heel down. And psoas, and all I have to do is turn my fingers in right there and I'm on it. Turn it out. Close the paper. I'm gonna have to work on the other side next time, cause I'm wearing this side out. See, we walking in circles, so this one side's gonna be over now, the other one, we're walking to the left. Okay. Now, when we have knee problems as well, just remember that the rectus femoris and the vastus medialis and lateralis is gonna be muscles that we're gonna have to really look at, okay? All right, so vastus medialis, deep breath in. All right, hold on a second. So we're sitting here, toe is out. I've got him captured right here. Okay, that's the resistance. My body weight's the resistance. Here's the contact hand, support hand. All right, so deep breath in, pull me, breathe out, pull me up towards you. And then since we're just right here, we're gonna go ahead and do operator. So remember that's the frog leg. Okay, deep breath in, pull me, breathe out, pull up. Good. Okay, we'll just go right up the muscle. Okay. Vastus lateralis. Turn the foot, the toe in. Deep breath in, pull me, breathe out, and pull me up toward you. Good. Up toward you. All right, so we got vastus medialis, lateralis, and then let's go ahead and lay on your side for me. And then we got the tensor fasciolata. All right, so we're gonna go heel to heel right here. Deep breath in for me, breathe out. Heel down. Heel down. Heel down. And then vibrocussor, and just knee to knee. Deep breath in. And again here, right across there with the vibrocussor. If you got your thumbs, you can come in here. So we're going, how would that be? Feet A on that. Okay. Whew.
Andy,
That's,
I have a question. On the operator, are you using your fingers or using the instrument? Because you're getting kind of with women in the private area, so.
I do my hand. That skin right there, that's where I start. Okay, right there. All right. So we're gonna take a deep breath in for me. We're gonna breathe out. Pull your heel down. Okay. And remember, the heel has to go down. If he's pulling you up, he's not doing it right. Okay. Deep breath in for me. Breathe out. Heel down. And again, this table's a little bit too high for me. Then I'm gonna come out here to the side. Okay. And I tell a patient, this is gonna hurt. I mean, if they're complaining about this,
lunchtime.
if they're complaining, if they're like, oh my God, and you're on the infrapatellar tendon, just go ahead and tell them this is gonna hurt worse. No matter what happens here, this hurts worse than that.
How much pressure do you push?
Honest to God, as much as they'll let me.
Okay,
And I tell them, you know, Brian was a patient, I'd say, Brian, I know this sounds kind of twisted, but the reality of it is, the more you can take here, the faster you're gonna get results. Now, Dr. Austin, before he even starts treatment on somebody, makes them sign a statement that if I ask the doctor to stop, I understand that he will not stop treatment. Okay? Then he makes them sign that. Okay? So
he pushes hard.
and what?
So he pushes hard.
Yeah. Yeah.
We can take majority of that pain away, Dr.
Yeah,
Barlow.
right.
And
Yeah, with
we
the
can show,
Hoffman,
we
he's
can show
got
it
that
to you
electron-
today.
He's got that electronic nerve block that if they have that problem, then you can block that out. Okay? All right, so here and then here, deep breath in for me, breathe out, go down. We're just going out to the lateral side of the knee right here. Okay? Lateral side, medial side. Deep breath in, breathe out.
With your thumbs, your vectors where? Go on. Thank you.
Okay? Same thing right here. Okay. Deep breath in for me. What are we on here? We got some of the vastus medialis and lateralis. feel down. This usually doesn't hurt as much. And then we come in here, I'm gonna get the rectus femoris again. Sometimes this does hurt when you're working on the knee. And I'm gonna get right here in the tendon right above the patella as well. Feel down. Okay. Now, the next move that we would need to do is the popliteus. So here are the moves. Infrapatellar tendon. We're gonna come out here on the lateral aspect. Just realize that these tendons come in here from the vastus medialis and lateralis. So we're gonna get here. We're gonna get the muscle, rectus femoris. Let's lay on your belly.
Just for clarification.
Now I'm not gonna push down on you. All right. So on this one, the foot is gonna start in, 90-degree angle, foot turned in. All right. And then as we come down, the patient's gonna turn their foot down and out. All right. So I don't bend over with the patient when I'm at my table. So I may have to here, but I don't. Okay. Take a deep breath in for me. Push down and turn your foot out. And I let my hand do the work so I don't bend over. Now, it's not wrong to do it this way, push down, but I'm not gonna sit here all day and bend over and do that. I'm just gonna hold it here, resist, and let him push against my hand and turn his foot out. Okay?
And on the PDM there, you're going from lateral to medial?
All right. And that's a good point. All right, so let me back up here, don't pick your foot up. All right, so the tendon comes out here on the fibular head, and it actually comes across. Let me sit this right here. So it comes across here, like this, like that. So the PDM is going to be right there.
May I take a picture of it?
Yes. She's going to take a picture of your popliteus. Just make sure you sign the waiver on that. So. Right there is the PDM. So see, when I'm doing that, that's what we're doing right here. And we just switch.
Then keep going in.
Yep.
I've been doing it so wrong.
I've been doing it too.
And isn't it amazing? You've been doing it wrong. You've still been getting results. Oh, sorry. All right. Now this TS. Yes. Here's the thing. Right now, almost. Can somebody grab that camera? Tendon, muscle. Okay. So I don't know if y'all have noticed or not, but when you get about midway through, that's when it really. They're just like, oh, you know. So, all right. So here. So now again, for the camera, I don't actually stand like this. I'm just getting out of the way of the camera, so I need to be clear on that. So here, a deep breath in for me, breathe out, push down and out. There, deep breath in for me, breathe out, down and out. And by the way, too, Brian, I push harder than this, so I'm just. All right, down. Make sure you turn your foot out. Okay, and that's exactly how we do it.
If the patient bruises the next day.
2, 3, 4, 5, 6, 7, yeah, 8. Okay. Do it again.
Yes, please.
Okay.
Yes.
All right. Head behind your head. Extend back. Rotate to the right. Right paraspinal muscles. Good. You can come in here on the shoulders and push down. Doesn't matter, but he's in this extended position right here. Okay, and the paraspinal muscles are going to extend and rotate to the ipsilateral side. We're going to bring this foot up. Hold right here. Hold. Weak. We're going to have to strengthen that. Glute max. Lateral rotator. Okay. The foot's coming in again. That's just a lever arm, but this hip is in a lateral rotation. We're going to pull the foot toward us. Hold. Weak. Okay.
What muscle was that?
This up here for us, your lateral rotator. There's a group of muscles there. There's about 5 or so muscles in there that
Oh, the gemelli and all that.
Yep. Okay. But again, so you got a group of muscles. They're so small that it's going to be difficult to actually isolate all of them in one unit. Okay. So these are just your lateral rotators. We're going to pull it out. All right. Now you look at this and you see this is weak. And what did we say that your inferior gluteal nerve, which is your glute max, what is the nerve root to that? S1?
5 S1.
Yeah, mainly S1. Mainly S1. And what do we say about the piriformis? Lateral rotators, S1. So see that S1, L5 or that S1 nerve root, something's probably wrong with that, because you got the muscles that are going to that get the main nerve supply from your S1. They're weak. Okay. All right. So what muscle is this? Splits out. biceps, long head, short head. Foot thin, medial rotation, membranosus, tendinosus. Hell, it don't even matter if you know the muscle groups. It's like, it's weak here. You know you gotta start there. It's weak here. You know you gotta start, if it's weak here, then what we're gonna do is take a deep breath in, when we breathe out, push your foot down, and turn it in. You don't even have to know what the damn name of the muscle is. You just know it's weak when the foot goes out, and you gotta strengthen it. If you don't know the name of it, if it goes in, you know it's weak when it goes in, so you come in here on this medial side of the leg, and you go take a deep breath in, breathe out, push down, and turn your foot out. Okay? Now, so you got your soleus, hold, okay? Then you got, there's a couple of different ways you can do this. You can come in here and do it like that, bring your feet together. I tell them, make it look like a C. Bring your foot together. Hold, good, and then relax, pop gluteus, turn it in, hold, okay. Now, so what we're gonna have to do in this situation is we gotta fix this butt muscle here, okay? The glute max and the lateral rotators of the hip, all right? So, what we're going to do in that situation is this is an extender, okay? And it's a lateral rotator, part of its job. Now this is going to be complicated because to really do this, you're going to have to bring the foot down, the knee down into the knee, and you're going to have to rotate the foot out, okay? All right, so it's 3 moves with that, so write that down. Glute max, we got 3 moves, all right? Now I'm gonna have an instrument right here to go across that whole butt muscle right there, okay? And we come in here and we just put it right here and it's vibrating, all right? But then we can also use our thumb on this in this situation. Let's just see what our thumb will do here, all right? So we're gonna extend it. We're gonna laterally rotate it. So what he's gonna have to do is, and you're gonna have to tell the patient 2 or 3 times what to do because it's a lot of movements here. And remember, you're working in their lesion. Okay, so it's down, in, and you're going to rotate the foot out. That's what they want to do. Now, for some strange reason, I can't figure this out, but patients think that when you say turn it, breathe out, down, rotate the foot out. Good. Relax. Again. Bring it in for me. Bring your leg in. Good. Rotate your foot out. See, that's the biofeedback to make sure that he's doing. So down, in, turn your foot out, turn it out, turn it out, turn it out. Good. Bring your foot in, bring your knee in. I'm sorry. There we go. All right, good. All right, so we did it 3 times. Let's just see what happens. Hold it up, hold. And that, all right. Could you feel it? All right. So we were testing the right side. So just so that you remember what the test was, he was laying on his belly, and we extended him back, and we turned him like this, and we pushed him, and he was weak. Okay. So what we're going to do here, okay, this is linked to this movement here. So what we're going to do to strengthen it, we have to put it in the shortened position. So on the paraspinal muscle, this is the shortened position on the right. Everybody got that? Okay. So you can come in here with your hand. If you want to, you can come in here with your thumb. You can come in here with an instrument. But basically, we're on here. Just relax. This is the spine. Here's the spine, and we're just lateral. That's where all your paraspinal muscles are, right there. Right in there. Okay. So you can use your hand, your thumb, your fingers, whatever you want to do. It doesn't matter. Okay. So, all right. So we're going to approximate the muscle. We're going to come in here and take a deep breath in and take your right shoulder and put it on your left knee. Deep breath in. There we go. All right. Now, when we lengthen this side, what do we do? Right, the opposite. Deep breath in, extend back, turn to the right. So that would be your TL. Okay? TS.
Yeah.
There you go. Everybody get that? I need to do it again. I'll do it again anyway. All right? All right. What does this paraspinal muscle do on the right side? It extends and rotates to the right. Okay? We tested it. He was laying down. We extended him and turned him to the right, and we pushed down his right muscle on his right shoulder. So what we're going to do is we're going to put the muscle in the approximated position. So we're going to extend and rotate to the right. Right paraspinal muscle that's weak. All right? We're going to come in here. All right? And we're going to take a deep breath in and tell the patient to take a deep breath in, breathe out through your mouth, put your right shoulder on your left knee. right there.
And you're just resisting 20%.
Yep. I think the hard that's fused, and then it's gonna fire into his medial cord, well, actually on this, right here going into that medial, you know, you look at the homunculus, that part right in there is pretty much screwed, okay? And now what you're doing is you're saying, hey, we need to get these muscle spindles to wake up down here and do their job, and by doing that, you're activating this whole system right here, okay? All right, and again, if it's stabilized,
Yeah.
how you gonna screw it? You
It's
can't
totally
take a damn
stabilized.
sledgehammer to that.
Been that way
you know.
for 10 years,
But,
yeah.
and again, if you're not, just take it slow. You don't, you know, we say 80 to 90% on the TL, but if you're not sure and somebody's in a lot of pain, there's nothing wrong with doing it and holding it, you know, at 20% or 30%, low and slow, if you have to. Okay, low and slow. Okay.
That's true also for people.
In here, okay, and at the sacral hiatus, okay, so right where I'm going to have to set you on your butt crack, okay, I need to tell him that before I do it, but, all right, but right in here on this butt crack right here is your sacral hiatus. But here's the thing, if you've got a tool, you can come across here like that, and you're still gonna hit all of the lateral rotators, but if you got your thumb, you're gonna come about 1 inch off. I haven't done anything with Logan, so I couldn't tell you. I'm the wrong guy to be asking that. Okay. All right. So what we want to do here is we want to take this foot and we want to rotate it out like this. So let's take a deep breath in for me, breathe out, and rotate your foot out for me. Good. Deep breath in, rotate your foot out. Now make sure you're paying attention because here in just a minute y'all are going to be doing this. All right. Out. Deep breath in for me and turn out. Good. All right, now then, all we got to do is go back and test it. Okay? Yes. And your group of lateral rotators. Yep. Absolutely. All right. So, all right, hold. All right.
Where's where's the stabilization and where is that at? On what, that side joint?
Yep.
Okay. All right.
Okay. All right. Then we come in here and we got the foot going out, it's going lateral, so it's the bicep femoris long head and short head. We're going to come in here to 110 degree angle, approximately. Just make sure that it's not 90. We need a little bit more of a acute angle. Hold. All right. I'm going to show you how to fix it either way. Hold. All right. So he blows out right here. Okay. So it's pretty damn simple. Push your foot down. Push it down for me. Right, relax. Let it go. I mean, the tendon's going to jump right out on you. Okay, so what you can do here is I've just got into a habit of coming in here. Okay, on the ischial tube is where all these hamstring muscles insert. Okay, or that's the origin. Okay, so you come in here. Okay, and then we're going to get the belly laterally. Okay, and then we're going to come right in here. Okay, right in here on this tendon right here. All right. I know we're dealing with the muscle spindles, but still, you're just going to work on the whole muscle. All right, deep breath in for me. Breathe out. Push your foot down and in. Okay, and you can just go right up. Just go right up the lateral side. If you know that the lateral side is where the muscle is weak, and you can come right up here, right on the origin here.
Just enough pressure to deform, correct?
Yes. All right. All right, so you got the biceps tendinosus membranosus package. Hold. Okay, it's weak, blowing out. All of these muscles insert on the ischial tube. And all we're going to do differently now is we're going to go down the medial side of the leg and end up in the medial aspect of the knee right here. Turn the foot in. Deep breath in for me. And this is why, for me personally, I just like having the instruments. That way you don't get around anybody's butt and you're not touching anybody on their butt. But when I'm in a seminar, I get special privileges. So, all right. All right, so 110 degrees, push down, turn out. Bring your foot out. Okay, I'm going to resist a little bit more. 100. Make sure you get it at 110 degrees. Out. Okay, out. All right, we notice the medial muscles that are weak, so we're going to come on the medial side. Turn out, 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 out. And then out. There we are.
That multi-head thing would work on the,
Yep.
on the upper stem? Just
Yeah, you can just come
kinda
right
go-
through here.
Oh, you're
Right
going
through.
sideways?
Yep.
Okay.
All right. Now, all right, so we've got the soleus hold on, push down. Soleus, pretty easy. All right, deep breath in, bring your foot down. Okay. Down. Down. Okay, and you can go in all the way into the Achilles, into this tendon here if you need to. All right, here. All right, flexor digitorum brevis, quadratus plantae. Here. All right, now if this is weak, the quadratus plantae, we want to come right in here by the calcaneus, just distal to that. Okay, so the quadratus plantae. All right, and here's this is all you're going to do. Both muscles, you're going to do the same thing. I mean, the patient's going to do the same thing. And I say, I'm going to make a C with your foot, and we're going to just relax for me. We're going to make a C, and then we're going to open your toes up like that. Okay. All right. So the only difference in this is your contact. Quadratus plantae, calcaneus, flexor digitorum brevis, at the metatarsals area. Everybody good with that? Calcaneus, metatarsals. So deep breath in for me, breathe out, extend your toes out. Okay? Quadratus plantae. All right? Flexor digitorum brevis. All right? And then we're going to test the popliteus. Hold. Right here, hold. Okay, now on that, make sure that you get this, you got to get this elbow down here. Okay, because you got to get perpendicular to the lever arm that's your work right here. Hold. All right. And then what we're going to do there is just the same one we do for the knee, right there. Okay. Everybody's good. So that's the 8 muscles. So let's test them.